All right, let's kick this off. Welcome everyone to today's webinar on our AI-powered mental health therapy chatbot powered by our Silicon Valley partner, Scalable Care, presented by the go-to-market team at mySHO. I'm your moderator, mySHO President AJ Pasha. The team at mySHO and Scalable Care would like to thank you all for taking the time on your Friday afternoons to join us and learn about this innovative AI mental health therapy technology that is timely and a relevant resource tool for our mental health practitioners nationwide who are severely understaffed to meet the skyrocketing demand for mental health therapy in a post-pandemic society dealing with increased gun violence, political turmoil, and the psychological side effects of social media. In this hour-long webinar, we'll cover the following topics. What is scalable care? How does scalable care work? What are the benefits of using scalable care? How can scalable care be used in different settings? And what is the future of scalable care? As a general rule, and so we can ensure we can cover all topics and materials that we have planned for the allotted time, please use the chat room to submit your questions. Those questions will be monitored and we'll grab a few to answer during the call. Additionally, if we can have all attendees mute your Zoom to limit any background noise, we appreciate that. After the full demo, we'll take questions in the order they're received. More than likely, your question will probably be answered as part of the demo, but we appreciate your patience to allow us to get through the full demo. We're happy to have follow-up calls with you to have an in-depth and detailed meeting to discuss your particular opportunity and use case. One more thing, today's call will be recorded and made available as a recorded webinar on our website. All right, to get us started, I'd like to introduce our team who will be presenting the webinar and demo of Scalable Care. They will also be contributing to the discussion and providing valuable insights into how this innovative tool is a literal game changer for how we connect to and treat our community's behavioral and mental health needs. Yeah, advance this a little bit. So we'll start off with our team introductions. Again, myself, I'm AJ Pasha, President and CEO of mySHO. Terry Williams, our Chief Executive Officer, and has a few words to share with everyone before we get started.
Great. Thanks for that intro, AJ. And I'll be very brief, right? And I wanted to give everyone an example of a situation that involves our young people in athletics. So a friend of mine, Kurt Akins, he does play-by-play with the University of Pittsburgh. And I was speaking to Curtis about the GridX technology and how it can be a game changer for the students. He said, well, Terry, he said, we have a major problem with the student athletes. I said, what do you mean? He said, well, you would not believe the amount of hate mail that the kids are getting after a poor performance of a ball game. I said, what do you mean? He said, well, guys are gambling. They're gambling on the game, right? And if they lose, they're jumping into the kids' DM and calling these kids all types of names, and to the point where the kids now that are playing sports need counseling themselves. So this is just one example of how this tool can, of the problem, and how we can deploy this tool to kind of help out a little bit, because there's a lot of stuff happening as a result of social media that we need to address and kind of get in front of. So I just wanted to take a second to kind of give you that example of what our children are going through in 2023.
Excellent. Thank you, Terry.
Yep.
All right. From our Silicon Valley partner, Scalable Care, we've got Alan Billin, CEO, and John Denny, CTO. They'll be presenting the demo once we get started. We have our mental health subject matter experts from mySHO, Dr. Bertia Jennings and Dr. Melinda Smith. Extended team, we've got Dr. Dwayne Hill, who's our Chief Medical Officer, Juan Roberts, who handles marketing and branding, and Ms. Carla Winfrey, who is a special advisor to our team. We've handling the veteran side of our program. We've got we're very honored and lucky to have retired General Rufus Smith. General Smith, are you on the call? All right, maybe General Smith will join a little bit later. We'll catch up with him. All right. And last, but certainly not least, is Dr. Sherry Blake, who is one of the most highly sought after media experts in the area of mental health.
Distortion. And then if I put that onto the recording it correctly.
Let's see if I can get that out of the way.
The option you've got is just to undo that and head into the effects rack and then go into filter and EQ, FFT filter. And then if I put that onto the default, if I play this back.
All right, sorry about that. I'm not sure where that came from. All right, again, we've got Dr. Sherry Blake, who's one of the most highly sought after media experts in the area of mental health in the country. Dr. Blake will give opening remarks about why she believes scalable care is the future of mental health care. And Dr. Blake, you're gonna have to unmute yourself. I had to mute everybody to get rid of that.
Okay. First
Perfect.
of all, I am so glad everyone's here. I mean, I'm very excited. I have been working in the field of mental health as a clinical psychologist for over 30 years. And I have worked and hands-on upfront, on the ground. Also, I've worked as an administrator. And so I know that without question, there is a need. There is no secret that there's a shortage of mental health providers. And this country is in the middle of a mental health crisis. One of the reasons I'm so excited about GridX, because I know it's a game changer for mental health. And when I say a game changer, it's a game changer both for the provider and for the individual who is in need of mental health. I've reviewed the program, and when, I'm one of these people who are not overly thrilled about technology. So when this was brought to me about a year or two ago, I was a little hesitant. And then when I really started, you can't escape technology. So when I sit down and I really reviewed the program, I was very impressed. Number one, GridX is a solid mental health app. There is no question. Like I said, I've made diagnosis for many, many years. It's evidence and based. But I want to just quickly highlight from two perspectives, because as a psychologist working with patients, also as administrator, trying to make sure services are provided, I see a couple of just important points that I just can't overlook. GridX provides 24 access to mental health support on a mobile device to individuals anywhere in the world. Do you understand what that really means? We have kids in rural areas. We have people all over the place that need support but can't get the support. This is an answer to that. Also, the solid support is provided in a friendly, and when I say friendly, if I can use the app, anybody can use the app. It's in a friendly, relatable, conversational style, which teaches and provides tools to deal with issues at hand. Also, it's safe, it's confidential, and I say confidential within limits, because if we know somebody is going to hurt themselves, we have a way to connect to get help. If we know certain things, it's so important for that person to get help and in life-threatening situations. And from the perspective of individuals providing services, when I say game changer, again, I mean a game changer. It is like having a virtual triage service. And if you think about a hospital, if you walk in an emergency room of a hospital any given day, sometimes the waiting room is packed with people. Some people are in pain. Some people may be bleeding a little bit. There may be a lot going on. But if somebody's not breathing, they're going to get seen first. And what happens with GridX, because it has the capacity to provide assessments and really weed out some, if you're a provider of care, you know which person is in critical need of help. And so it helps triage what's significant right now and what can be held off later. It reduces the second thing that I love about this, and I really see this, reducing face-to-face time. Again, as an African-American psychologist, I only represent 1 of 2% of us in the United States. As in psychiatry, there's only 4%. So there is not enough, number one, African-American, but there's not enough psychologists or psychiatrists or mental health providers to go along. The fact that we can reduce the need for face-to-face time allows the provider to manage their caseload, to manage people. And if you have 100 people on your caseload, you need to know which one needs immediate care and which one needs maybe care or support. GridX can provide that support to allow those people in need of immediate service to be seen. GridX also alerts the provider if it's a situation, it can connect. We have the capacity to connect to a hotline, to 988 hotline, which is the national crisis hotline, which is life-threatening. It also can flag the therapist or the counselor that's involved to say, hey, something's wrong with this person, and in terms of a serious issue, and we need to attend to it. So you have your caseload and you have your immediate people that you'll still be doing face-to-face, but yet you have the support of all the other people on your caseload. And it's like having a co-therapist as a provider. One of the things too I love about GridX is just not a chat box. It gives tools. It teaches, it gives a way of interacting, and you can pick it up anytime. And last but not least, because I know I can talk, and again, I am really excited about this one, the fact that you can collect data, you can collect matrix. So if you're a provider of a system, if you're an administrator of the system, you can see what area of the people that are using GridX is in really need of help. How efficient is it? How many people are using certain things? Also, it helps you oversee financially. It helps you oversee from a manager perspective. But the bottom line, and I will stop, when I say a game changer, I wish I had this 30 plus years when I started, because it would have made such a difference, because the information is solid, it's evidence-based, and I wouldn't be talking about it if I didn't personally believe this is the key, because we cannot see everybody and we cannot get to all the crises that we have in this country. But GridX offers a great alternative to a lot of the things that we need in terms of providing services. So I'm excited. Kids can use it, adults can use it, it's available. So I'm gonna stop, because I think music will probably come on if I keep talking. So I'll just stop. I don't know, my 2 minutes is probably way over. Thanks so much.
Thank you, Dr. Sherry. We very much appreciate that. All right. Well, I mean, if you're not excited after hearing that, I don't know what to tell you. You might not be alive, because I'm very excited. Thank you. All right. Well, so we're going to dive into the webinar portion and the demo. So I'm going to stop sharing and turn over to Mr. Alan Billings, the CEO of Scalable Care, and let Alan take it from there.
Terrific. Thank you, AJ, and thank you, Dr. Sherry, for that introduction. We are so delighted to be working with you and the team, and we're happy to be here today to present some of the capabilities of Scalable Care. Just a little very brief background. Scalable Care is a team of professionals who came together with a wide range of backgrounds that came together under a common vision, and that is to use the advanced technology, like things like artificial intelligence that you see all over the world these days, and pull it together as a positive force, a way to help people live better lives. And the product that we've built in order to help do that is a digital care platform. And that platform uses conversational AI and other advanced technology techniques to exponentially scale the delivery of mental health services. That's our goal. The platform's designed so that it can power any number of web and mobile applications where people can talk to a chatbot and then access evidence-based tools, exercises, and therapy so that they can help improve their mental health and manage it on an ongoing basis. The applications and chatbots can be configured for virtually any population and any demographic group, old, young, various cultural groups, anything that you can imagine. And the chatbot speaks over 80 languages. So language barriers are no problem on our platform. The platform itself and the applications that come with it are designed under two different scenarios. First and foremost, we've developed this so that it can enhance and extend the existing therapists, counselors, and staff members that are treating patients and working with patients. We believe fundamentally that the heroes are these people, the people who are working with the end users, the people like Dr. Sherry. we built a platform that is meant to be a tool to support these heroes, not to be the hero itself. It's also designed to, however, in the case where there isn't a therapist available or no provider or support system for the user, it can be used standalone so that we can make the care available to large populations of people, no matter what their resources are and what the availability of providers are for those people. With that background, I can dive into a demonstration of the service. So let me do a screen share if I could. So what you'll see here is a service that's live today at gridx.org is the URL. And this is a service that we launched targeting teenagers and young adults. And we developed in conjunction with the University of California, San Francisco's Department of Child Psychiatry and Departments of Neurosciences. GridX is one example of an implementation of the Scalable Care platform. This type of implementation can be adapted, as I mentioned earlier, to a whole bunch of different possible demographic groups. This specific one is targeting youth, and it includes the chatbot functionality and the evidence-based therapies that are available through the platform. And I'll go ahead and sign in and show you what those look like in this case. So when I land on the homepage, I get presented an interface with a chatbot that I can just talk to straight up. And this is free form text. I can tell it anything I want to, and it will capture my language, identify any mental health challenges, emotions, and needs that I have, but also just talk with me. And it gives an opportunity for users to express themselves, but while at the same time on the back end, it's capturing the information necessary to match those users to the right content and the right tools that are available in the app. So before I dive into more of how the chatbot works, let me click on this tab called Library. And this shows you a list of all of the content that's available within the application. So these are all materials of various forms. They may be things like journaling exercises. They may be meditation-based exercises. Sometimes they're psychoeducational content so that you can learn as you go and develop your own skill sets so that you can manage your mental health over time. And it's a massive library. There's virtually thousands of these exercises. I can sort them and filter them by types of life challenges. I can also sort them by skills, whether they are breathing exercises, journals, and I can also select them by the amount of time that they take: 5 minutes, 10 minutes, 15 minutes, and others. That's a snapshot at a high level of the content that's available in the application. As I'm using any of these tools, I can click on any of those and just simply select the heart button, and it gets added to what's called my backpack. Now, of course, depending on the age demographic, this backpack can be named anything that's appropriate to the group. Since these are often school-aged children, we use backpack as the name because that's relevant to school kids. But everything, as I mentioned earlier on the screen, is configurable, including all the graphics and the names and things that are in the application. So under backpack, these are the exercises that I have collected for me that I've found are useful, so that anytime I come back to the service, I can click into those and use those applications. The other tab that I will show you is this thing called expeditions. Now, what expeditions are pre-configured and curated exercises or use cases, journeys that are created by mental health professionals around a particular topic. So if, for example, I'm someone that's struggling with starting relationships, I can click on this exercise and it walks me through a set of content and skills around managing, around starting relationships. Similarly, I could click on any of the others and access things like relationship drama, general anxiety, decision-making, sleep, etc. Now, all of these expeditions that show up in the application, these are configurable on the back end. So when we're working within a particular deployment, let's say it's a school in Oakland, California, there is going to be a set of expeditions, if you will, or journeys or use cases that are appropriate for the kids in that school system. If we launch the same service in a rural setting in, say, Kansas, there may be a completely different set of expeditions that are appropriate for those kids. In each of those deployments, we can work with the leadership at those schools and identify the challenges that are appropriate for their students or their users. Now, that's using the example of schools, and of course, it's also available for other populations, and in which case, again, it's a completely different set of expeditions that may be appropriate for those users.
Alan, I'd like to add real quick, the characters can also change to a great extent. Like right now, we're involved with a group in Australia, and we're making a bot that is going to resonate for Australians. So, all the jargon is different. The way it interacts is different. I mean, if you've met an Australian, you know it, right?
That's right. This is where I would make a bad attempt to do an Australian accent, but I'll spare you all that that drama. Okay, so then now I'll click over to chat, and I'll just show you a couple things here. I'm going to just type a phrase in. I'm feeling bummed out today. Now this is again, it's free form. I've specifically chose a phrase that is slang based. I say I'm bummed out. Now, what a lot of chatbot technologies do is they'll look at the phrase that someone types in, and it has to be a direct match to some form of predefined words or phrases that they'll use to match the user to the response the chatbot gives. But in our case, we're using the technology called natural language processing. This is similar to what we're all have seen in the news with ChatGPT and others. It's built off of large language models and has capabilities of not just looking at the string of letters and words that the user types in, but it extracts meaning from what the user is saying. In this case, I typed, I'm bummed out. The system identified that that's sadness. And so it says, I don't know what's going on exactly with you, but can you tell me more about what you're sad about? And I'll just say something like, my friends are being mean to me. This is live software, so sometimes
and something to know, yeah. So Alan also, so the bot remembers things, so it might give Alan a funny response sometimes because he's had other conversations with it.
Yeah, every time I show this, I have a different challenge. Sometimes, sometimes it's more relevant than others, but this time it did a pretty good job. It came back and says, "I'm sorry that for you and your friend, all human relationships go through phases. Can you tell me more about that? We got in a fight or in an argument, let's say." And so then it goes through this and it says, okay, well, we've collected some tools that can help you deal with your emotion. Would you like to try them? So I'll go ahead and say yes. At this point, the chatbot goes into the library and it pulls content that is associated with either sadness or relationship related stuff. Often it also will bring back things that will help ground the user and help them feel more centered and connected so that they can control their emotions before they do other exercises. So I could go ahead and check this exercise out. If that didn't seem right for me, I can click and select another one. Love a little, laugh a little. I can check that one out, and it'll bring it up and give me an exercise that I can go through and help manage the emotion that I'm having at the time. If I like this exercise and it's helpful to me, I just click the heart button and it gets added, of course, to my backpack. Let's see, where is it here? Love and leave. There it is. Okay, so that's the basic function of the chatbot. The last thing I'll show you before some of the features on the back end is this tab called Materials. Now, this tab is only available to the provider or therapist or counselor, could be even like a staff member that is working with a group of people. And the idea here is that this is a tool within the app that say the therapist can use to help manage their patient population. So right now, let's pretend that I'm a therapist and I have a group of patients, and I want to, let's say John is one of my patients, and I want to send him some exercises that are relevant to him based on a conversation that we've recently had. And since this is actually the case, I'm going to say John has some challenges controlling anger. So I'm going to create an assignment, and I'll put John's name in here, his email address.
It can also pull emails from other systems if you have people rostered and things like that. That's what the schools do. Like a school counselor would have the people assigned to them, or the teacher would have like their classes.
That's right. And then I can go in here and I can select content that's appropriate to the conversation I've just had with John. I'll send him controlling anger. Don't let anger be you. And these are materials that I've put into my materials list because I know they're relevant for one or more of my patients. And then just for fun, I'll say embracing your silliness. So after John goes through his anger exercises, he can be silly. So then all I do is click send, and John will receive an email with links to this content, and it'll take him into the application and take him through those specific exercises, and he gets a relevant experience. And this is one of the ways that we're connecting, again, the therapist and the therapist interactions with the patient with the chatbot and the application, the technology aspect of it. So that brings together the experience. Now, if John is having challenges controlling his anger at any time of the day when I'm not there, when he's to talk to, he can pull up this application, go through this, and it helps him control the situation. Okay, I will now show you something a little more detailed. I'm going to click on this tab, and this shows our management console on the back end. Now, this interface would be used either by us supporting an organization or by certain trained members of the organization to access some of the back-end features of the service that control what you saw in the application for the end users and the therapists. And just to make sure I call this out explicitly, I'm now in our development environment. So the data that you're going to be seeing here is not live actual user data. These are test users. And I want to make that clear, just because we very much respect privacy and want to make sure that we're not revealing in a webinar any private information from any end users. So it has a dashboard. It shows how many interactions and conversations are going on. But then I'll click on a couple of these other tabs to show you some basic capabilities. I'm going to first go to conversations, and this shows all of the dialogues that have taken place. If I click on all dialogues, these are all of the dialogues that have taken place on the platform. Now, these can be filtered by provider. So if I am a particular provider, I can see the dialogues that I can only see the dialogues associated with my patients or my users. Or if it's depending on the access level of the user, it could show all of the dialogues for this implementation. But
like researchers use that viewpoint.
That's right. So I could click on any of these and it will pull up, and I want to just make sure that, you know, I'm pulling up something that is relevant, but because these are, like I said, test users, and it'll show the actual history of the interactions that user has had with the bot. Okay, so then I'm going to show a couple of other things here. Those are the dialogues. I can also look at the full list of actual messages. And if you see here, it'll show even the recent message text that's been typed in. The other thing I'm going to show you are reports. So if I click on this tab over here called challenges, this shows me the number of chat interactions within my patient population of all of these various mental health challenges. Now, again, this is the back end system, so these numbers are kind of low. But what this is telling me is that I've had 12 of my patients, or 12 chats out of my patients, where the topic of addiction has come up. I've only had 3 where the topic of avoidance has come up, or that where we've identified avoidance as being the mental health challenge. There's bullying, there's cognitions, there's community, depression, emotional difficulties, and it's keeping track of all of those. I can click into any of these, let's say family, and it'll show the actual interactions that took place between the chatbot and the user around that topic. So all of these people have had issues of some sort where family challenges have come up. And if I know the user's ID, I can click on the ID. It shows user ID instead of name for privacy reasons. But if I'm a therapist, then I can look up any particular one of my patients, so that I can see what's happened with that patient. Now, if I go into that person's profile, it actually shows the challenges that individual has faced over the period of time. As John mentioned, the chatbot has a memory, keeps track of the previous conversations, and it shows all of these various things that the user has talked about in the past with the chatbot. It also shows what emotions have come out in the course of those interactions. It keeps track of things like what their favorite music genre is, what their favorite sports are. So there's a lot of user data that we're capturing on the back end as well, so that the chatbot can have relevant interactions with the user, but also so that the therapist can get a good snapshot and view of what's happening with their patients over time and in between appointments.
Yeah, something that's new, that's actually in production that is coming up as a new challenge is, you know how they're purging the Medicaid rolls around the country? People are flipping out about this, right? Because they're losing their coverage and they don't know what to do. So we had to actually react to this and be able to provide good guidance from the bot.
Yeah, that's a good, and another good example, actually, if you remember when Kobe Bryant passed away in that horrible accident, this was deployed in school systems, and we saw that rising up as a key challenge or issue that was being discussed with a lot of
actually, Alan, it was people. Now, the students were actually more concerned about his daughter dying.
Yeah, and that's what I was just about to say. It was that event, but what we learned from the dialogues is what John just said, that the majority of the students that were, or a large percentage of them at least, that were upset over that accident, they were upset over his daughter more so than Kobe Bryant himself.
Trauma, yeah.
because they had connected at the child level. And so that's an example of we don't just have the challenges that come up, but we can learn from those challenges relevant things that can then be passed on to the therapist so that they can better serve their patients.
Yeah, so Los Angeles Unified School District is a big user of this. So that's quite a laboratory. I think it's the largest school district in the country.
So similarly, I'll click on this tab called Emotions, and this is also tracking. The first one is tracking the challenges that arise in the conversation. This one is tracking the emotions that are arising commonly within the conversations the chatbot's having. So there have been 27 chats on anxiety, 31 on sadness. So we can see trends of not just challenges, but also emotions that the patient population is experiencing.
And one of the things we're trying to demonstrate through some projects is that the happiness increases with users over time. And also a side thing is, I think users start becoming able to recognize being disgusted with certain things so they don't become anxious anymore. It's pretty interesting to see this kind of emotion evolve, right? Where people get more emotional vocabulary too.
That's right. Thanks, John. Okay, so then the last thing I'll show you is are these expeditions. Now, I'm going to now go to the content section. Under content, this is where we manage all of the tools and exercises and therapies that are in the application. And I can go in and add new ones, or I can modify any of the ones that exist today. And they're all categorized according to emotion type, life situations, and other categories. And the reason we do that is that's how we match them to conversations that are taking place within the chatbot. So if I'm a therapist or a researcher, and I create a new mental health therapy to a new exercise to give to patients to help manage any particular condition, I can put that exercise in here. I can map it to the appropriate emotions and challenges related to that. Let's say it's an exercise that helps people manage anxiety. I'd put in anxiety. I might put, school anxiety, test taking, friend stress, things like that. And then anytime those topics come up with the chatbot, that's one of the exercises that the chatbot can then present to the user to help manage that emotion or that life challenge.
This is the sort of thing that where Terry brought up the student athletes.
Yeah,
easily could create new content for them, and a challenge classifier where we have a challenge classifier. Just pick up the language about that sort of thing, like people you don't know threatening you or sending you just things that are affecting your self-esteem or feeling of safety. Mm-hmm. Right. And that sort of thing. And that could be made available. That it could also be rolled together with other things into an expedition. And that's the sort of thing that, frankly, like an athletic program could assign to their students for mental hygiene. Right. Because if you're playing college sports, D1, you're probably, going to have some fans that are going to be betting on you. That's a problem, right? Or could create a problem.
That's right. So the last thing that I'll show you here are those expeditions. If you'll remember, there were a number of those around social anxiety. I think I clicked at one on starting relationships. The list here is actually slightly different than the one that was in the live app, because as I mentioned before, this is the development environment. So there are some random ones here that may or may not be live. But to John's point,
you can also unpublish them. Right. So you can make things that are seasonal.
That's right. You can make them seasonal. You can unpublish them, edit them, and publish them again. These can also be created in any of a number of languages. So for example, this one on social anxiety is available in English, Spanish, ZH, which I'm not sure what that is.
Mandarin. It's Mandarin, simplified.
Mandarin. Mm-hmm. So they're all of the content can be translated to different languages, and this is where we would track that. But if I look,
and we translate it, the system does. You build it in English, we'll translate it.
that's right. So I can go into any one of these, let's say social anxiety, and I can go down and I could change the picture that shows up. I can edit this. I can change the introduction, the description, and then this is the list of content that shows up in the course of this curated journey. So if I wanted to create one that was around Terry's example, social media bullying or something like that, or sports related anxiety or something like that, I could name that here. I could put an introduction description of it, and then I could pull content from the library that the user could go through to help them with that particular issue. The other thing that is nice about this is I can also click on this button, export, for any one of these, and it will create a, it may or may not show up on the screen with the screen share, but what that does is it copies this expedition, so then I can import it again, and then I have a duplicate that I can go in and modify and change to create a new one. And that helps to expedite the process of creating these journeys.
Yeah, so anyone who's technical will probably recognize ML. It's YAML, which is yet another markup language, and it's editable. It looks a little technical because it's got some hash marks in that, but you can edit it and then you can re-upload it, so you don't have to rebuild anything, or you could create a new one off of an existing one. It's a way to really make things fast.
All right, so I'm going to just check really quickly and see if so if I create one on social media pressure, I could type in a description, add some content, hit submit, and it's as easy as that to get it created and published. Then if I went back to this GridX, clicked on expeditions, it would show up here. So that's how easy it is to create curated content in the application. All right, let me stop there. I don't know if there are any questions that may have come up in the course of the conversation. I'm happy to answer those questions. And if not, AJ, I can hand back to you once we get through that.
Yeah, I don't see questions. What I was thinking we could do is run through a few use cases. Maybe starting with eConsult. Is that okay to touch on that one?
Yes. And when you say use cases, you just kind of describe how we're using the platform for eConsult. Yeah,
or just kind of some of the things that are in development going forward. Veterans health. Public safety. Terry and I could talk about that one. Employee assistance programs, how the technology applies to those different scenarios.
Great. Yes, happy to do that. Let me stop the screen share so we're not distracted by the GridX guy that is with his cape on. So of course the platform, as I mentioned earlier, can easily be adapted for a number of different applications, and these can vary widely from what you just saw with this application targeting teenagers and young adults. One of the applications that Terry mentioned that we are in the process of rolling out right now is with a partner organization that is using the platform to support frontline healthcare providers like pediatricians or primary care doctors who are delivering services, mental health service, delivering all kinds of healthcare services to patients. They may or may not be very well trained in mental health, those frontline providers, but they're the ones that are seeing the patients or the users on a regular basis. and they need support, they need help. If someone comes into one of these pediatricians and they have a mental health challenge, and that pediatrician just simply refers them on, oftentimes in many of the systems, the wait list for that patient to see a provider is very long. And so those doctors need support. So what we've done is we've configured the platform to give those doctors a consultation system where they can request support from specialists and or researchers, therapists, psychiatrists to provide the advice necessary to support that patient. And then in the meanwhile, they use the GridX platform that I just showed you to provide that patient with some interim support while they're waiting to see one of those specialist providers or therapists that have the wait list. And so that's an example of how the system can be used within a broader ecosystem to not just give these tools to the patients, but also to help offload some of the work that's taking place by the providers, help them operate more efficiently, and make the overall system work more smoothly, can reduce the backlogs, the number of patients in the backlogs. The other important part of that deployment is we are also implementing an upfront assessment. And so when the users first come into, say, the pediatrician, we can give them a PHQ-9 test, a GAD-7 test. We're even developing with the researchers some newer techniques that are more brief, more abbreviated. So rather than take them through 30 questions about their level of depression, it's more of a lightweight thing where we can identify 3 or 4 major challenges that they're having, match them to the content that's available in the application that I just showed you, and then decide whether we want to give them more detailed in-depth questionnaires like GAD-7 or PHQ-9 or others. So that upfront assessment piece is an important part, because it then gives the providers, both the pediatrician as well as the supporting group that is consulting with the pediatricians, the information that they need to help with the patient, to help triage the patients. And then also it provides the information necessary to provide the interim digital care that the patient needs to stay happy and healthy in the meanwhile, while they're waiting on the waiting list. So that's one example. AJ, do you want to guide us to the other examples that you guys are looking at?
Yeah, I'll pause. Were there any questions on this use case from anyone in the group or on the call? Checking our nope. Okay, we'll move on to the next one. Public safety. Terry, you want to give just some quick notes on that one?
Well, one of the things that we uncovered as it relates to public safety is recidivism. Using the technology as a tool for the probation officer to stay in constant contact with a person that's on probation. So as a condition of their release, right, and based upon their assessment, the therapist within the system can continue to stay in contact and send that person that's on probation mental health exercise and expeditions to do while they're being introduced back into society. That kind of sums it up.
Yeah, and I'll just add to that. This is we believe this is a good application for both inmates currently in a correctional facility, especially leading up to a parole, to have them use this technology and therapy to address the issues that caused them to do the things that got them into prison or trouble in the first place. And like Terry said, I think a perfect application of this is to have them use it before parole, and then having them use it while they're on parole as a condition of parole. and I think what that does, that incentivizes the person to continue to get to correct the behaviors that got them in trouble. And I think this is something that's sorely needed. We've based on some of the research we've done and the folks we've talked to, this is definitely the resources aren't there to address mental health in this area. So a public.
And I'll just add to that just a little bit more, because currently nothing's being done, right? So a person goes into jail for 5 years after a number of domestic violence situations, and the whole 5 years there's no treatment. So when the person gets out, what are we really expecting to happen? So what the system now understands is that you have to address the mental as well. Right? While when they get out, they have a chance to integrate back into society with some treatment.
Yeah, and a lot of the tools that are in GridX, and they can always be added to, clearly, and therapists are great at building tools that they like to give their patients. They can quickly add them to this for whatever the need is, but it teaches coping skills because frankly, that's what a lot of folks lack, right?
That's right.
It's effective coping skills. So, and it results in a lot of really negative outcomes. So.
Excellent. All right. Thank you, Terry and John. Moving on. So employee assistance programs are another great way for this application to be utilized. And we believe, and it just, the value it brings is immense. Some of the things we talk about, some of the value and features, providing access to employees 24/7. As we know, a lot of times mental health issues don't happen between 9 and 5. They happen at 2 o'clock in the morning. And so being able to have a resource available to give someone an outlet or give someone a sounding board to express themselves in their time of crisis is so critical to solving a lot of the gun violence issues we're having. It could be anything from domestic abuse or anything. It just, people need someone to talk to. And unfortunately, our system is stretched to capacity and can't always provide that type of service. So this is something that does fill that void when an actual human therapist can't be there. The affordability is there. This is definitely something that could be added to an existing program and provide immediate value. They can be accessed from anywhere. I think this is one of the great things about this. It addresses the geographical challenge. Someone's in a rural area, someone's in an area that doesn't have therapy offices, even if their job or if their community offers it as part of a benefit. They may be, it may be a couple hours away to drive to get there. It's just not practical to do that when someone's working every day a 12-hour shift. They can't take off of work to go drive to the big city to go see a therapist. And so having this available really allows the geographical barriers to be overcome and provide people the opportunity to get the mental therapy they need. Privacy and confidentiality, I think John and Alan have already addressed that. This is HIPAA compliant, definitely applies by all the different rules regarding privacy. So I think overall, this is a great tool. Yep. Go ahead, John.
I'm sorry, AJ. So we put in additional things in there too. Like if you saw in the demo, it didn't have that infinite scroll like text messages usually have. Mm-hmm. We could put that in. We've had that in there. It was removed from that version because kids might grab some other kid's phone and scroll through the messages, right? We didn't want them to have that information there. It disappears when you go off the screen.
Right.
Useful, right? So that was one of the reasons. So there's it's not just privacy and safety and confidentiality. We actually built in avoiding the dysfunction that just plagues kids, the way kids act, right?
Yep. Absolutely. Excellent. Do we have any questions on any of the use cases we've shown thus far? All right, we must be doing a good job. Yeah. But yeah, kind of just, this is kind of just shows a little bit of an overview. GridX is the current UI UX that was demoed. We've got public safety, new patient intake, mental health professionals. Some of the features, automating repetitive tasks. And actually here, I'd like to ask Dr. Smith to say a few words regarding the benefits from a therapist standpoint of the documentation and the ability for it to assist with Medicaid and Medicare reimbursement, which is a challenge, I know, for a lot of our professional therapists. Dr. Smith, I think you should be able to unmute and join us. Let me see here.
Yes, thank you very much for having me speak regarding this. It's my pleasure. One of the things that we're challenged with is being reimbursed for services. So one of the good things that GridX can allow for providers and practitioners is that it can allow for the documentation to support the particular, sorry about that, the particular services that are being provided. It can increase our reimbursement rate, because one of the things with reimbursement is the documentation that services did occur. And sometimes as a practitioner, you may get so involved in actually providing the care that you're not documenting necessarily everything. So having the GridX, the AI bot, to be an assistant to a practitioner or provider that allows for that documentation to be there. One of the things that it also helps us with is improved time efficiency for our patients. Again, we have more time to spend with the patient versus just looking at just the time of the documentation piece, making sure that's there. So it gives us more quality care for the patient. It's also evidence-based. The expenditures out there on the exercises that we give are quality-based, they're evidence-based. So our outcomes are going to be more positive, approvability to measure and to gather data that we need. And it's more uniform, using the exercises within a particular, even a setting within an organization. If everybody's using the same exercises within that organization, we're more or less guaranteeing that everybody's getting the same service. Sometimes depending on who the practitioner or the provider is, maybe they're a little bit more using more evidence-based, whereas if we're using the same product at the same time and the readiness of it, then we're providing the same service across the board to our patients. And that's critical, so that, no patient is left behind, sort of, and that at that point, that we're giving everybody the same type of opportunity to have positive outcomes.
Excellent. Thank you, Dr. Smith. Are there any questions on the benefits of the documentation of the platform?
There was a question from Ricardo. It was about CPT codes and if it automatically figures those out for use in billing. Right now, there's one HCPCS code for this that's specific to this. Otherwise, it would just be, if you're using this to do your screening, doing those questionnaires and the screenings, that would just be something you would put in your normal bill. This wouldn't actually handle the billing component.
But it would just justify the billing component.
Absolutely.
It would support that we're, because I know we do upload when we do a PHQ-9 and when we do all those different screenings, we upload those. So if this would already be uploaded and our scores would already be there, then that documentation would already, be included within that particular setting.
Yeah, there's a larger question here too that I think is important to point out what the question is and what the answer is. What's this going to turn into in the future? And there's currently legislation around digital therapeutics and reimbursing for those. It was introduced in both the House and the Senate last year, but it was introduced too late to pass it. It came back this year. It's bipartisan in both party, both House, both parts of Congress, and it's going to go through. I mean, the CBO is going to come back with their estimate. They're going to modify Medicare and Medicaid, and there will be codes for these things in the future. Some things are going to be governed pretty tightly by FDA if it's things about meds, but this is the sort of thing, this is going to be the future. And that whole thing about reimbursability. Yeah, there's going to be a whole new category in medicine for digital therapeutics.
Absolutely.
Yep. Awesome. Okay, I'll open it up one more time to the floor. If we have anyone that wants to ask some questions that haven't been covered yet, feel free, this is your turn to do so.
Hey, AJ, it's Terry once again.
Yeah.
I'm really excited about the 988 relationship with the technology, and I know Dr. Sherry was as well. So if I could ask her to speak a little bit about how the technology can work in concert with the suicide crisis hotline.
You know, I am, again, very, very excited because what happens, like you said, crises do not occur in the neat hours between 9 and 5. And a lot of times, even if they do occur, you can't address all the crises when you have a huge caseload. So the issue is it really it's a risk management type thing, because what happens is the 988 is a federal hotline. So they're mandated to accept all calls and texts. So what happens if you're in a school system, for example, and it flags that one of your kids are in crisis, but it also is going to flag 988 or has the capacity to do that. So not only are you getting notice, but 988 can respond to that. So if it's a life-threatening thing, it's major. Also, another aspect of this, because I do work on both sides, the 988 operators across the country are overwhelmed with calls. And many of those calls are not crisis calls. Many of those calls are calls where people, you know, they want to know something, or they may be having some anxiety, but those are the type things that GridX could easily address, which would reduce their level of incoming calls, which makes sense, because otherwise that system, like all other systems, are going to be totally overwhelmed. And I talk to some of the operators now. Also, they're not as trained as some other people in the field. So sometimes they're relying on their, I call clip notes, cheat notes, to help making sure they're responding. But if GridX was part of that, can you imagine how efficient that would make that entire system? And they could address the crisis. So I'm just really, I'm so hopeful. And I have been doing this for years and dealing with people in mental health. And I know this is a game changer. And you're right, AI is here to stay. So we all have to look at what is the best use. And I think this is definitely it for mental health.
Excellent. Thank you very much,
Mhm.
Sherry.
Thank you. If you have questions about mental health, feel free to ask, because this is a great opportunity. And I'm so proud that both of our teams, we've worked really hard. And this is just the beginning of it.
Excellent. Fantastic. There's one more use case that we may be able to touch on. I'm gonna see if Dr. Bertia Jennings is available to speak on it. Dr. Jennings, you have a moment to talk about complex care.
Hello.
Yeah, we can hear you just fine.
Well, the use with complex care is, again, like what Alan spoke about with the pediatricians. A lot of times, because there's a shortage of complex care trained providers, oftentimes the pediatricians are left to handle cases and on not only to triage and frontline, but also to manage it, all within a very short period of time. And so that GridX would be that assistant, again, that whole continuing level of care of excellence and continuity and a standard. So it would also, when discussing it with other colleagues within the complex care community, it can also serve as screenings, but also services. A lot of times when you talk about complex care, you're talking about really the coming together of a lot of different pieces to it, whether it's the social service part of it, whether it's the therapeutic part of it, whether it's the other supportive therapies, which can also be integrated within the GridX application. Another example of that was also we had a physician that's a sleep expert. As she said, that there is not enough time in order to treat everybody, but with the GridX and her being able to upload that information, then the accessibility is there, and also to the pediatricians. So they're able to do the work and have information available in order to provide that care.
Mhm. Excellent. Thank you very much, Dr. Jennings, for that. All right, do we have any, like we had a few questions submitted to chat. Anything you want to address, John, before we head out?
Well, I think that there were a couple of use cases that were described, right? It was one is around people who are contacting a hotline and they're really stressed out. And could this be used for that kind of population? And I'd say the answer is yes. And, you know, could you be a connector? Yes. I think that just working with you, AJ, we'd be able to ensure that it was done, you know, in a timely way, that it was, you know, hitting the mark, right?
Mm-hmm.
And with the sensory community question as well, yeah, absolutely. Just to echo on what had been said about there aren't enough hours in the day or days in the week for a lot of the subspecialists to see people. We're working with a sleep expert at UCSF right now, who works with children. There's only 4 of them in the entire state of California, and they have like a year-long backlog. So that's the type of thing where there's just so much demand, and we can't train people to do it fast enough, right? So these use cases should be able to be set with this. It might be, you know, a different expedition. Those are fast to produce, and that can be made available to people. This is really the only way to provide, you know, really ultra low cost and scalable behavioral health care services that are high quality and monitored. So, you know, we look forward to trying to do that with folks.
Mm-hmm. Awesome. All right. Do we have any final words from any of the attendees? Any additional questions? Well, thank you all. We really appreciate everyone joining, learning more about how Scalable Care and mySHO can help people all over the world improve their mental health. If you have additional questions or you think of something after the call, feel free to reach out to any of us or the person who invited you. And we'd love to schedule a follow-up call and get into an in-depth and detailed discussion about how we can help you treat more people and kind of help the communities you serve going forward. So again, thank you all from the team at mySHO and Scalable Care, and we look forward to seeing you all again. Thank you.